Okay, welcome back. Well, the market is doing just fine. It's up, as I said, just moved up to the high point of the day to almost 18,100 now. Jefferies is bullish on the Indian healthcare services space. They believe Indian hospitals are in a sweet spot. The broker believes that hospitals are a structurally strong story, and Global Health, which of course operates Medanta Hospitals, is their top pick. To discuss opportunities the local domestic market and, of course, international medical tourism as well. We are now joined by Dr. Naresh Trehan, CMD of Global Health. Dr. Trehan, great to have you with us here on CNBC TV 18. Appreciate your time as always. Could you, as I said, Jefferies, which is a global investment bank, has you as the top-rated name in the hospital space. Tell us how is international medical tourism looking, because that's a very profitable part of the business for hospitals. What have you seen in the quarter that has gone by? And if you can tell us what's the outlook for the next couple of quarters?
So good morning first, and thank you for having me on your show. Overall, the India healthcare space has got a lot of headroom in the sense that we are still very underserved. So the story of India requiring more and more healthcare, more hospitals, more nurses, more doctors. The whole sector is moving at a very rapid pace because people have become more and more conscious of their health now, especially after COVID. And that we are now seeing a lot of traction from patients who are seeking quality and also getting the right advice for what their systems may be affected with, or trying to stay healthy. That's the big thing that has come, which is added on to the healthcare space. So now, when you ask about the international travel business, yes, it is coming back. It used to be like 12 to 15%. In our case, we are one of the leaders in that space. It's up to now 6-7%. So as the flights are being added on, as more and more countries are opening up, there is the concern about COVID is waning. There is definitely that interest that was there before is coming back and very robust. So we expect the upside on international value travel to be quite good. And also, if you know that we are going to be G20, hosting the G20 this year, the government has taken some very good steps to actually make it happen. As you know, our Prime Minister has announced serve from India, serve in India. So all these things, the healing process which we have described, puts us in a very good advantageous position as compared to other countries.
Okay, all right. Hi, Dr. Naresh. Good morning. Thanks so much for speaking to us. Well, you made some very valid points out there. Now, international medical tourism, which used to be 12 to around 15%, it's at around 6-7%, as you mentioned. So in the coming year, do you expect to go back to that range of 12 to 15%? And that has an impact on the average revenue per bed. So what's the outlook on that particular parameter? I think in the first quarter, it was in that vicinity of around 60,000 odd. Go ahead, Doctor.
So as I said, international travel for medical travel is coming back quite robustly and coming quite healthy from the countries that we had before. Some of the countries had had visa problems, all this other stuff happened because of COVID. Now they have opened up. There are hundreds of, patients waiting, not only for us, but for the whole sector who are wanting to come, because India offers, and we are in it, that we offer the highest quality of care at a reasonable cost. So India advantage is actually that we are offering those services not for poor medicine, but the highest quality of medicine that you can access anywhere in the world, but at a very, very affordable cost. So that advantage still remains. And we believe that this will continue, and even not only continue, but surpass the old levels.
Okay, so in FY24, you expect to go back to that 12 to around 15%. In turn, that would have an impact on the average revenue per bed, right? So any outlook, any kind of guidance you could give out there? And also give us a sense about the current occupancy rate. I think it was in low 60s. You were guiding that it goes to the higher 60s. What's it at now?
Yeah, it's there, but the point is that we cannot discuss our results. As you know, SEBI rules do not permit that. We will be announcing our results in the middle of February. So we will be giving this whole data. But like I said earlier, that COVID being over, travel opening up has brought back the patients who have need now, so that there is no hesitation in, because Medanta Global Health, our main mantra is stick to quality and also maintain the highest end of care available anywhere in the world. So
Sure.
with that, people have shown a lot of confidence in us. Without giving you numbers, I can tell you that that confidence is very robust. And we are, as you know, we operate at a very high end, like lung transplants, liver transplants, heart transplants, kidney transplants. So all these things are actually our USP. So on
Got
one
it.
platform, we have all the services like cardiac. Cardiac, we have a very high-end services, all cutting-edge technologies available. Like you can talk about now the new frontiers. I mean, operating on patients who were considered inoperable before. We do it on a regular basis now. We are doing the percutaneous valve program. We are the leaders in that. And then there is even preventive health and predictive health. We are the leaders in. So those things we are concentrating on. And as you may have noticed, some of the best doctors have also even more have joined in. So we are looking at a very bright future from that point of view. And I think that our other services and facilities are also performing well. And the new ones are coming online. So there is from our point of view, the outlook is dependent on the quality of care we deliver. And that's
Dr.
what we
Trehan?
are, is the core of Medanta. And that's what we are sticking to, and making sure that people will get the best treatment at the most affordable cost that can be offered.
Got it, got it. I also want to talk a little bit about the opportunity that you see, if at all, in the digital e-pharmacy space, because, you know, a lot of your peers are moving fast here. Apollo has got Apollo 24/7. They're getting funding into that business as well. Max has about digital as 15% of its sales. For Medanta, for Global Health, what is the kind of trajectory you see in this whole omni-channel platform space? And would you be looking to explore it further over the next few years?
Most definitely, what we have already done is started a very intense home care program. We have the pharmacy is already online, that we are actually in our space with our patients. We are doing extremely well. And then also along with that, the labs that people, because of their experience, of the quality they experienced with us during COVID, there are more and more people are seeking us for home pickup or home drawing of lab tests. So all these three frontiers are moving very well, and we are very cognizant of it, that this is the service we want to do, because we want to take medicine to the patient rather than patient coming to the hospital for every little thing. So this is the new realization across, mainly in the public, that yes, many services can be delivered at home. And the fact that you will see that during COVID, we got so used to the patients and us, all of us got used to video consults. Like if we were doing 100 video consults a day before COVID, we are doing several hundred now. All our physicians are very busy, so that people then get the benefit of their first consult on video. And then if they need something, then they come prepared to the hospital, because a lot of our patients come from long distance, and it's saving them a lot of trouble and money to travel twice. So instead of that, they can travel once, prepared, knowing what they need. So all these things have been, all the levers have been activated, and they are actually growing rapidly.
Okay. All right. Thank you so much, Doctor, for stopping by. Wishing you all the best. And we look forward to chatting up with you post your numbers. Then we could discuss more on the outlook and the financial performance as well.